This is Carissa Enright, the primary nurse planner for TNA District 4. And this is Speaker's Guide to the CNE application process with TNA District 4. What does the primary nurse planner need? In overview, ANCC is driving all the steps in this process. As the primary nurse planner for TNA D4, I will manage the paperwork. This video is designed to help you, the content expert, understand what I will need from you to qualify for what TNA will accept as CNE. I'm not only monitored by TNA for my ability to maintain standards, I must keep records and make reports to prove I'm doing my job. So if I seem to be asking for a lot, please know it's because I have to. Let's start with the rules that ANCC and the Texas Board of Nursing impose on all CE offerings. Both entities want to prevent nurses from claiming continuing education for topics that are part of their original education as nurses. If the audience needs to refresh their knowledge of previously learned information, this has to be a minor fraction of the CE. In other words, lectures you may have previously given to undergraduate nursing students cannot be repeated for nursing CE, even if it includes recent research. The entire presentation must emphasize new discoveries or recent literature designed to change and grow nursing practice. Simply put, if your audience does not in some way hear something that will change how they practice nursing, it is not continuing education. In addition, Texas imposed its own rules that topics that are purely designed for self-improvement, like yoga, meditation techniques, time management, or the like, cannot be counted in the CE requirements imposed by the state for renewal of licensure. Here is a list of what cannot be continuing education. BLS or CPR are basics and do not change practice. In-service programs are primarily designed to teach nurses how to utilize new equipment or explain changes to policies and procedures. These are institutional updates. Similarly, all institutions need to orient new nurses. These hours cannot count as CE. Nurses who are returning to the workforce after an absence are relearning the basics. And as mentioned, self-improvement is the responsibility of the nurse and is not counted. New areas of research on nursing resilience, compassion fatigue, and nursing self-care are now being allowed, but the direct application to improving nursing practice must be plainly visible in documentation of the teaching. Economic courses designed to help nurses invest money or improve their financial position are not allowed. How to dress or improve professional appearance is not CE worthy. Any academic course that is not specifically designed to improve nursing skill or care are not counted as CE. And any presentation that is geared toward a person without a nursing education, like information a nurse might present to patients or patient families, is not regarded as CE. ANCC wants to see a clear paper trail that will prove that evidence-based teaching practices are used. The ANCC embraces the gap analysis as their model for education development. This means that before you can call anything continuing education, you must prove that the audience needs this education. University faculty are not accustomed to utilizing this process. The assumption for undergraduate and even graduate nursing courses is that the audience has self-identified their need for the information. It is best if you have documented proof, such as a survey or an article that describes the knowledge gap for you. I will work with you on how to document this. Perhaps more challenging is the evidence that a gap exists. You need to be able to describe current practice and show how your teaching will change how nurses nurse. And ANCC has made learning outcomes into a two-step process. First is a statement addressing the practice gap, called a learning outcome. And the second step is the behavioral measurable outcome that must be part of your evaluation of learning. Lastly, as professional continuing education continues to transition to a focus on quality, CNE must be able to identify how continuing education is contributing to quality, indicate in what area this activity will impact nursing quality. This slide is where I need your help more than any other part of the process. Elements recorded on the education documentation form include the timings that prove the content matches the CE awarded, teaching methods and active learning strategies, and references to prove that information is recent. TNA will certainly audit this information, so it must be as complete as I can get it. Generally, if I have a copy of your PowerPoint slides or a complete outline of the topics you plan to cover, I can fill in the rest. But if you fill in this form completely, I can usually approve the CE hours overnight. This is the required format for this information. If you give me a different format, I will transfer the information into this form. As you can see, the content must be detailed. This proves that the CE has relevant content and that references are used to make it evidence-based. In an hour, your topics will flow from one major concept to another. For each section, give an estimate of how long you plan to cover that topic. Remember that the evaluation of your talk will also require time, so we will add time for evaluation and questions to the end. Unless you co-present, this column will have your name and credentials listed. This last column will be repeated for each change in topic and will be compared to your timings for the learning activity. For example, a group discussion will take more than 5 minutes. I absolutely need you to help me with this page. TNA will not allow any CE approvals without 3 to 5 references per hour of content. And don't even bother to list any references older than the last 5 years. The only exception to the 5-year rule may be the textbook, which may not have a more recent edition. The rest of the paperwork is relatively easy. I will need to document that you have no conflicts of interest. Or if you do have, or what appears to be a conflict, I must prove that I've resolved it and can assure that your talk will not be biased. This is just a note to let you know I must have some paperwork after your talk. If you want your own copy of the evaluations, we will need to talk about how we can arrange that. This last slide is just to show off. As the primary nurse planner for TNA D4, I have an obligation to collect and store a lot of information. Thank you for agreeing to help me in this endeavor.